Hello, this is Dr. Gay from First Look MRI, and this is a 38-year-old male with ankle pain for a couple of years. They came in to get evaluated, and we see a few findings. Number one, there's a very tiny osteochondral defect of the medial talar dome, very, very small, barely discernible right here. It shows up best here on the fat suppressed PD sequence here. You can see this little area of brightness right there. So it's an osteochondral defect. The cortex is intact. There's no evidence of loosening or displacement, so our job is to measure the size, say where it is, and say, is there fluid undercutting it? No. Is it loose or unstable? No. Is it displaced? No. So just small OCD, medial talar dome. And also in this, we notice this fogginess here. This is within the sinus tarsi. We want to look in the sinus tarsi. Now in the sinus tarsi, it's right in this region here. We see some ligaments. Just to go over these again, along the superficial aspect anteriorly, we see the inferior extensor retinaculum here. Some of the superficial fibers come down across the sinus tarsi here. So it's part of the sinus tarsi, the superficial component. If we go in here where it's cupped, in this area is the cervical ligament, and the cervical ligament, I can see these linear strands that look like the fibers are intact. If we go back here, we start getting into the talocalcaneal interosseous ligament. Here it looks like I do see some fibers, but there's some little erosive changes around the sinus tarsi, and it looks a little foggy and a little bit of brightness within the fat. There should be more dark and fat suppressed. So it looks like they have some mild inflammatory changes in the sinus tarsi, and again, these little enthesiopathic changes can be normal, or they could be related to some abnormal mechanics of stress with enthesiopathic reactive changes. So when we see anything in the sinus tarsi, we want to look at the posterior tibial tendon to see if they have posterior tibial tendon dysfunction, because when that does not work well, that puts abnormal stress in the sinus tarsi, and it could look just like this. And note here, when we look at the tendons, we like to put the foot down in plantar flexion because it straightens out the tendons, and we don't get that magic angle phenomenon. See, the images are more perpendicular to it, and when it curves forward, it makes a 90-degree bend, we'll get that magic angle phenomenon, and it's really hard to tell if it's tendinopathy or if it's just normal. So on the posterior tibial tendon, this is the medial side now, we do see this foggy posterior tibial tendon that starts up here, and it's just a little bit too plump. And right in here, it's not even very well defined, all the way down to near the attachment. So the whole posterior tibial tendon here is abnormal. We'll put on some sagittal images here. This is the lateral side, medial side. Whoa, here you can see this definitely too thick all the way up, and also there's a moderate amount of fluid around it. So it looks like a hypertrophic tendinopathy and fluid. We call that tenosynovitis. So it does not look like it's ruptured, but it definitely is abnormal. This is the axial T2 sequence, and on this we can see our highest cut here. Looks like it's a little bit plump on our highest cut. As we go down, it's enlarged, foggy and ill-defined, little longitudinal intersubstance signal there. And so when the tendon is just thick like that, it's not torn or ruptured, we can call it either hypertrophic tendinopathy or hypertrophic partial tear. I don't think it makes a difference. The main thing is to make sure you don't say it's ruptured or there's a gap, and also you don't say that it's attenuated, and they may want to treat this more conservatively. And now here's the flexor digitorum, flexor hallucis here, looking completely normal. Laterally we have the peroneus tendons here, peroneus longus and brevis tendons, brevis in front, longus in back. And then we have the anterior tibial, extensor hallucis, extensor digitorum tendons here in the front. They look completely normal. So in the end, this is a case of hypertrophic tendinopathy and tenosynovitis, or hypertrophic partial tear and tenosynovitis, the posterior tibial tendon with no tendon rupture. And also some probably early inflammatory changes of the sinus tarsi, which may be related to posterior tibial tendon dysfunction. And lastly, that small osteochondral defect of the talar dome right over here. And thank you very much.